Houston chiropractor, Dr. Gregory Johnson, and today Miguel has been so kind as to let us do a YouTube video with him, and he's a special case because he's already had lumbar spine surgery for a herniated disc, and he's still having severe low back pain and leg pain running all the way down into his legs, into his calf. So we're going to show you what we do for herniation of disc post-surgically. Okay, let's have you close your eyes and flex your head forward and backwards, which this is the first thing we do on every patient. Now neutral. Now he's got a lot better posture now than he did when we first started, but his head's still a little bit forward. His head's turned to the right, and we know he's a side sleeper. And his left shoulder's a little high because his whole neck and head have translated to the right on the x-axis. Down the pelvis and the low back is also translated on the x-axis to the right too, so that means he's got a spinal curvature or scoliosis in here to boot. Okay, so let's come over here today. We're going to do this one. Now, a lot of post-surgical patients are, okay, scoot up that way just a little bit. There you go. A lot of post-surgical patients are scared to see a chiropractor because they think it's going to mess up their surgery site, but it's just the opposite actually. So what we're going to do is decompress him on the y-axis. Now push yourself up, make sure you're in there really good. And raise the legs so that that relaxes, changes the angle of the pelvis and relaxes the entire paraspinal musculature from the sacrum all the way up to the occiput, or the skull. So see, we get his legs up, check his reflexes, which is not much there pre-adjustment. So, here we go. And just take a deep breath through your nose. Make sure your teeth are together and your tongue's not in there. Let all your out and relax. There it is. Yep, home run. That's what I call my RD, or ring dinger. This is manual spinal decompression. But see, he's still got a lot of scar tissue down there, and I know you felt that right there, didn't you? In the low back, yeah. So when you start getting scar tissue ripped loose from the zygapostyle joint and also the intervertebral foramina, you actually initially get some pain with this adjustment, but then that'll all start easing off once we get that scar tissue down. And here you go, let me see your reflexes. Look at the difference in his reflexes already. Much better. Good. Yep. That's me, so I'm going to take care of that over here. I'm going to do the Terminator on him today. See, when you come to Advanced Chiropractic Relief and see us, patients can go home and tell their family and friends and co-workers that when you go to the chiropractor, let's turn sideways and come over here, Miguel. Come in here and I put you on the rack, then I pull your leg and I shoot you. But it's all for good three-dimensional biomechanical correction. And now see, his legs are exactly even, which they have been coming up short most of the time. But as I bring his legs up, watch his pelvis raise up in the air, right there. That tightens up and hurts, doesn't it?
Yeah.
So, a lot of times, doctors will miss the true underlying cause of these problems, which lies down in the pelvis, the sacroiliac joints, the sacrum itself, which is the middle triangular shaped bone. So we start off by adjusting the sacroiliac joints and pelvis first to create a good base or foundation. There's L5, there's L4, and you can see the angle on my arm changing the further I go up. Now when I hit that L3, you saw him react to that because he's got a little bit of spinal canal stenosis in there, and that's a painful area. Also supplies the large intestines. There we go. That's good. Nice and easy. Excellent. And same here. And you notice when I do this adjustment, I'll put your head down just a little here. You'll notice that not only am I getting tension into the spine, but I get a rotation along with the adjustment. And I just opened his joints up a little more. So we see if we can get any more movement. Yep, right there we did. T12. Now, we recheck that. Legs are even. I bet you this feels a little easier than the first one.
Oh, yeah.
Very good. And we always get feedback immediately from the patients. Now, this is the Terminator. I know y'all are big fans of the Terminator. Miguel's not such a big fan right now, but he will be later. And we got happy feet. Kind of like our 4 kitties, they get happy feet and rub us down. You see, they're getting all the muscles that are affected by the pinched nerves coming out of his lower back and sacrum and sacroiliac joint. And those are tender, especially right here in the calf and the gastric union muscle and soleus muscle. Then we work all the way up in the hamstring. And then on the side is a lot of people call this the IT band coming from the pelvis all the way to the knee. And boy, when you have misalignments in the pelvis, that thing gets tighter and tight and very sore. Now we're in gluteus, medius, and maximus, and now we're down deep in the piriformis. We do that on both sides. Right there. Yep. Okay, very good. Now I'm going to do a little softer version for him. More of the rubby, feel good, deep vibration so we can get his blood flowing more. That brings needed oxygen and nutrition into the cells. Plus it's also relaxing for the patient and the musculature. A lot easier than the Terminator. But you can still see that we get the entire pathways of the tissues that are involved with his condition. And for those of you who have already had surgery and are worried about getting chiropractic care, you should not worry about that, because we look at the diagnostic testing and we do orthopedic neurological testing to make sure that it's safe to do these procedures and that it will benefit the patient. And that's what the exams show us. Orthopedic neurological examinations and consultations that we have with all of our patients. And you see a good examination on a herniated disc patient on a video that we shot yesterday for y'all. You notice we say y'all a lot down here in Texas, especially Houston. We got the Houston rodeo going on right now. And we have advised Miguel not to go bull riding. That wouldn't be good for his lumbar spine or his pelvis. And it's not even good for the professionals that do it. There we go. You look way back in the archives of our videos last year, we had the very similar patient with a herniated disc that we showed on Houston Texans Day. They have a lot of events here in Houston at the Reliance Stadium where the Texans play. But now one of the biggest events in Houston is going on, the Houston Rodeo. And Renee and I are actually taking off early on Monday and going down there to see REO Speedwagon play. Kind of our old time rock and roll favorites, and Renee and I's favorite song together. What's the name of that song, honey? You can go ahead and say it. Can't fight that feeling. Yeah. Yeah. That's it. She couldn't remember either. She looks pretty good for 80 though. No, she's a jewel. I wouldn't be able to function in here without her. And no, I know somebody made a comment the other day, don't replace Renee with the Terminator. So we're not doing that. We're not terminating Renee, no matter how often she asks me to. There we go. Well, that feels a lot better than it did initially, doesn't it?
Very much.
All right. Good deal. Alright, so let's turn you on your back now, Miguel. I already got most of these. There we go. Got one more small one down, C6, C7. And look how his feet are flared out evenly now. Before, the right one was flared out a lot more. Yep, legs are even. Now, he had a positive straight leg raise test when we first started. Let's see if that's still there. Besides the tightness that you feel pulling in your hamstring, do you feel any sharp shooting pain in your low back or leg when I do this?
No.
Excellent. That's a straight leg raise test, and that's the test you always want to run on people with herniated disc and sciatica. How about this side? Excellent.
No.
We couldn't do that initially, could we?
No.
Now, he's also had knee surgeries, and you can really feel that knee surgery on that right side and the left side. You'll see a lot of play. See, there's about a ½ an inch worth of play there. So I decompress the knee so that the femur can articulate properly with the tibia and fibula down the lower leg. And then we're going to get in the last thing here. We're going to work out that IT band or tensor fascia lata muscle one more time. Well, and that's not near as sore as it used to be either, because it used to almost flop off the table when I did this. Yep. And then we're going to do a muscle spindle, Golgi tendon apparatus move down here in his tibialis anterior muscle. Will make him feel like he's walking on air. Excellent. Good. Yeah. Let me help you up sideways, Miguel. Towards Renee. There you go. Good. And notice we always get our patients up sideways rather than sitting them straight up. That's very important. Even for them at home, getting out of bed. Good. As you can hear, I'm getting good movement on all his joints. And the left one wasn't quite as bad as the right one today. Elbow, wrist, all the way through the pathways again down to the hands and fingers. And then I squeeze the radius and ulna together and pull straight out. That'll help to make the carpal tunnel adequate size so it doesn't get any numbness and tingling in his hands and fingers. Okay, good. So, Miguel, would you mind telling our viewers what your history's been, how you came to see us, and the difference between what you've had done other places and here is?
We found you on the internet,
YouTuber.
And,
Good.
So many chiropractors, I believe over 50, this is the best one I found.
Well, thank you very much. And you also, what do you think about surgery on your back? And you be candid.
No, I don't want.
You wouldn't advise people to get that before they tried conservative care, right? Yeah. Very good. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.